Stangebelisco here. I have recently discovered that I have high blood pressure, and it's really pretty doggone high sometimes. So I've been to my physician, and he has prescribed a prescription medication for that blood pressure. This medication is not without side effects. I'm on another medication, still the clonazepam, known as benzodiazepine, which also has side effects. I'm having an awful time getting off of that. I'm sure a lot of you can relate to that. Practically everyone I've talked to has had experience with benzodiazepines. They seem to be overprescribed. So I'm on these two drugs right now. They both have side effects. And it's quite possible that I may, next Tuesday when I see my doctor again, end up on another medication for blood pressure, possibly an additional medication for blood pressure. Here's the rub, and this is what I told my physician too. I don't want to end up being a prescription pharmaceutical junkie, where you get one drug that has certain side effects and you take another drug to deal with the side effects of that drug, and then there's several side effects to that one and you have to take 2 or 3 more drugs to deal with the side effects of that one, and before you know it you're on half a dozen or a dozen different prescription medications. I know someone at the Deadwood Rec Center who's on 11 different pharmaceutical products. Now, I don't want to bash the pharmaceutical industry and say that they're involved in some evil plot. Oh no, I wouldn't dare say such a thing. Prescription drugs in some cases have saved my life, most notably antibiotics on a couple of occasions have saved my life, quite literally. So, prescription drugs are not necessarily bad things. However, I think a lot of times they are, in that they are overprescribed. People take a lot of prescription drugs unnecessarily, and I'm not a doctor, so I'm not going to offer any qualifications for that opinion. But I told my doctor I don't want to end up being on all these different drugs and feeling rotten all the time because of the side effects. What's the point in living to be 100 years old instead of 70 if you're going to spend those additional 30 years in abject misery on account of side effects for the pharmaceuticals that you take to extend your life? It's like being held together with duct tape and baling wire. At what point do the returns diminish and decline rapidly? And I think maybe a lot of you have thought the same thing. I think perhaps we might want to rethink our prescription drug attitudes, but this is only my opinion. For myself, I do not want to end up on 11 different pharmaceuticals with 33 different side effects, and half of those pharmaceuticals are intended just to deal with the side effects of the other half. I don't want to go there. And I think a lot of people already are here in the United States of America, where the medical industrial complex, or I might call it the medical industrial racket, seems to be involved more in making money for itself than in making happiness for people by making them well. I don't know what's going to come of all this. I don't think politicians have any solution to the problem. It seems we get one politician in there, makes the situation worse, and then another one turns around and corrects that by making that situation even worse. Politics, government doesn't seem to have a place in all of this. It doesn't seem to work, and yet the free market isn't working either. What will? I've actually thought about just running off to the wilderness and letting nature take its course. And by wilderness, I mean somewhere like Barrow, Alaska, or some other such place. But I've dreamed of things like that. But everybody does. Where would I get my Walmart supplies in Barrow? Maybe they probably have a Walmart in Barrow. Do you suppose they have a Walmart in Barrow? Oh well. Maybe someday I'll tell you. From Barrow. Stan Gibilisco, signing off. Until next time. So long.